Good afternoon, everyone. Thank you so much for joining us for our webinar today featuring 3 community organizations that we are so fortunate to partner with at this time. My name is Bridget Kinch. I'm with Building Impact, and our team has had the opportunity over the course of the last couple of weeks to work with these 3 amazing organizations that are doing work to support so many families and individuals across Greater Boston, to have an opportunity to highlight all that they are doing and to thank you already for being involved. As you know, it's Volunteer Appreciation Week, and we don't think that there is any better way for our volunteers to be thanked than to hear from the organizations themselves who they've supported through the work that they've done with us. And so we're very, very grateful to have Larry Siemens, Jennifer Hanlon, and Darren Cordy join us today to have an opportunity to talk a little bit about the organizations that they lead and also the work that they're doing with your support to support our community at this time. My colleague Elsa and I from Building Impact are here to talk a little bit about how you can get involved. And so the structure of our discussion today will be to hear from each of our 3 panelists, and then to move to a section where Elsa will talk a little bit about how you can get involved with virtual volunteering projects and programs like the ones that you've heard about today. And following that, we'll have a question and answer period as well, where we invite you to participate in the chat or to raise your hand using the chat feature of raising your hand. If you go to the panel on the GoToWebinar side of things, you will see that there is an opportunity to raise a hand or to participate in a written chat. So if you do have questions for our panelists today, we invite your participation in that for our Q&A. Without further ado, I want to start out by welcoming our panelists today. And also, I want to say a quick thank you to the GoToWebinar team from LogMeIn, who have both been volunteers to support these organizations in our virtual volunteering, but have also provided us the technology platform for us to be able to bring all of our team together, our network together today. We have over 100 people who have joined us for this discussion live today, and we're just so grateful that all of you are here to hear from these leaders. So without further ado, I'm going to invite each of our leaders to talk about the organizations that they lead and to tell you a little bit about the population of their community and who it is that they serve. So without further ado, I'm going to turn it over, Larry, I believe first to you. Let me make sure that I do that properly. It's a little feature here so that I can hand the mic to you. All right, Larry, the floor is yours.
Great. Well, thank you so much, Bridget, and thank you to my additional panelists for all the great work their organizations do, and most especially thank you to all the volunteers who have supported Family Aid Boston through Building Impact for over 17 years. I think we are one of the longest serving connectors with the great volunteer work that Building Impact has done. So a little bit about Family Aid. We're 104 years old. We started as the Travelers Aid Society, so any of you who are on the call today probably have heard that name if you've been in Boston for some time. We changed our name a few years ago. And we are one of the largest providers of services to over 1,200 homeless children and their parents in the greater Boston area. Every day we're working with families who are among the largest and poorest in our communities. And we are do a variety of different services. We provide over 123 shelters in the city. We have over 200 families who we're working with through the Boston Public Schools and the Boston Children's Hospital, families who are on the precipice of falling into homelessness. And then we have about 160 families who are coming out of homelessness and who we're helping to stabilize into housing. We provide housing placement services, daily counseling services, case management services, connections to community referrals, and job and employment training programs. And thank you again for having us here.
Thank you. Thanks so much. I will pass the mic now, Larry, from you over to Jennifer to talk a little bit about Women's Lunch Place.
Hi, yes, thanks so much for having me here today, Bridget, and for our partnership with Building Impact. It's been a terrific partnership and collaboration for us, so thank you. And hello to my fellow panelists as well. So Women's Lunch Place, I think, is the youngster agency on this panel. We've been around for 37 years. We are a day community for women who are experiencing hunger, homelessness, and poverty. We're in the midst of the Back Bay, and we serve about 250 women a day and about 1,500 women over the course of a year. We're built on the public health model. So at the very base of that pyramid, we offer safety and nutrition. And then we hope that when women are receiving nutrition on a regular basis, that they can start to make decisions to move their lives forward in a positive manner. So to that end, we offer direct care services, things like showers and laundry, just the basics of taking care of yourself. We offer toiletries, personal hygiene products, emergency clothing, along that variety. And then we have wraparound advocacy services. So we can assist women with housing options, with food security, with things like photo IDs, which is a complicated process for a person who doesn't have an address or a mailing address. So a variety of things that we can do to assist women moving forward. And we strive to provide dignity for our guests. We offer a beautiful and inviting, location, but also relationship building. We work really hard to support women. We know 60% of our women are homeless. Many have trauma and abuse in their backgrounds. A lot of mental health and physical health issues that need to be addressed. And we want to treat our women with dignity and respond to not necessarily always behavior, but the issues behind that that really need addressing. So it's a beautiful community. It's a wonderful group of women that are so supportive to each other and really inspirational every day. Thanks again.
Thanks so much. So I am now going to pass the mic over to Darren Cordy, who runs the Cambridge Community Center. So let me pass the mic, Darren, to you, and the floor is yours.
Thank you very much, Bridget, and also thank you to the panelists. It's nice to meet both of you through this process and hope we can work together in the future in some way. And thank you to all the volunteers who have, even before COVID-19 outbreak, have been critical to our work through our partnership with Building Impact. But even more so, it's been really inspirational to see the amount of people who have reached out and who have given their time and to help us do the work that we're doing, which is so important. The Cambridge Community Center was founded in 1929 by a group of Black pastors because the local YMCA was for white men only at the time. And the pastors really wanted to find a place, create a place where everybody was welcome to build community. And building community together is still our motto that we live by. The major issues that they were trying to solve at the time were delinquency and truancy amongst the young children in the neighborhood. But throughout our history, the thing that's really rung true is we've always worked to quickly respond and adapt to the evolving needs of the most under-resourced, underrepresented youth, families, and seniors who live in the entire city of Cambridge. And we've always stayed true to that work. We have a long history of hoarders who have served on our board of directors, and we have paperwork in boxes all over our building that we've finally been able to organize and get into an archive at the Cambridge Public Library. And you can just read through the board minutes, and throughout our history, our board has stayed committed to that very important mission, which is, during a time like this, become even more important. Our main programs and services today are youth programs, so year-round after-school and summer program, in which we provide our program for as low as we're legally allowed to, and about 90% qualify for state subsidies, and another between 70 and 80% qualify for free or reduced lunch. Just to put that to scale, free lunch is the federal poverty rate, which is around a family of four making less than $24,000 a year. A lot of people don't envision Cambridge as a place with that level of poverty, but we know firsthand that it exists. We also offer teen programming. One of the more well-known programs is the Hip Hop Transformation, which we launched in 2013, which just recently went through a year-round program where we teach kids the authentic history of hip hop culture, and we equip them with the skills to write, record, produce, perform, distribute their own music. They're on iTunes and Spotify and all that. You can look them up on the Hip Hop Transfer. Actually, I think they're releasing a single today that they've been able to do through this pandemic. And then we have community services, which our biggest one is actually our annual Thanksgiving luncheon, where around 200-300 seniors are served with Thanksgiving dinner with all the fixins. We do a monthly community meal program called the Coast Kitchen. And then we also host the Cambridge Winter Farmers Market, where we provide SNAP match benefits for community members to double the value of their SNAP and EBT card and get fresh produce brought right into our gymnasium. So that's who we are. That's what we do. And again, very honored to be on this panel and thankful for our partnership with Building Impact.
Great, thank you so much, Darren. So as you've heard, organizations that have been in existence for decades, each one of them, I think what we wanted to talk about now is how you've had to pivot, how you are addressing needs in your community, the kind of needs that you're seeing during COVID-19, and specifically how some of the programs that you have been offering have been helped by some of the volunteer work as well. So Larry, I'll turn it back to you so that you can talk a little bit about how Family Aid has transformed during this time.
Thank you very much, Bridget. I think during the time of COVID, Family Aid has truly leaned into its new name. And to understand a little bit about what we've had to do, I think we need to take a moment, if you don't mind, and share a little bit about our families. So Darren, I really appreciated your comments about the families in Cambridge, and I think the families you're working with are very similar to the families that we're working in the greater Boston area. So a little bit about our families. Our average family size are 4 family members. The vast majority are women with children, underage children who are in their care. And they are among the poorest families in the city. The average income for all 1,200 of our families is $17,000 a year. So I want everyone to think about what that means. Can you imagine living with 3 children somewhere in a shelter even with only $17,000 a year? So how does a family that only makes that kind of money working in service roles, typically working, they're the people serving us our coffees, cleaning our offices, cleaning the hotel rooms, how do they make ends meet? Well, one thing is they take 2 or 3 service jobs, and then they rely on the other services in a community to support them. So for example, if they've got babies, they'll take their child to a daycare center where their child is provided baby food and diapers for the day. And their children are going to go to school where they'll get a free breakfast, free lunch, and then they may be going to programs similar to Darren's in Boston where they'll go to an after-school program where they'll get, again, supplies, supports, and potentially dinner. And that's how a very poor family in the city of Boston survives. They also might be relying on other family members, maybe an elderly grandmother who lives down the block who needs to take care of their child while they're working their evening shift at a hotel or cleaning our offices. Now let's think about COVID. A lot of the expense and concern and what you're reading in the paper has to do with the true medical crisis that's facing our community. Every day, I don't know about you, but I cringe before I open the Boston Globe to read what's happening in our communities. But beyond the medical crisis, there's a true economic disaster that has already occurred for all the poor people in our community. They're on the precipice of a medical crisis, but all of them are suffering an economic crisis. So the day before the COVID crisis hit and the governor called a state of emergency, 70% of our families were working. They had jobs. They were handing us our coffee. They were cleaning our offices. They were driving us to different locations in their cars. They were working, and their children were getting supports and services from the community. At the moment of the crisis, literally 2 days later, 50% of those, 20% of those folks lost their jobs, 50% of our families were working, and 5 days later, 0 were working. And their children now were at home. So family now had lost all of their income, and their children have lost diapers and the food that was provided to them from their daycare, their school, and their after-school programs. Additionally, those families, many of the families we work with, live in what's called a food desert, which means there's not a Stop and Shop around the corner from their house. There isn't a Peapod that can deliver food to them, even if they had the money. There may be a small bodega, but that was a question, right? How do you help people get what they need? So Family Aid has had to pivot its work from doing case management and housing services and property management for over 400 units of housing to actually providing humanitarian relief. So we're now in the process of making sure that each of our families have enough supplies and food through a variety of ways, one of which is a great thing that we'll talk about how Building Impact has come to help save us and our families. But we're working now on a daily basis of making sure that our families are actually getting the supplies and services they need, in addition to helping them navigate the crisis of COVID. Right now, 6% of our families are living with COVID, which is a higher percentage than the general population. And part of it's because, again, if you've been reading the newspaper, lower income communities with existing health issues, kind of a high social determinant of poor health, are being impacted more so than other communities. And so we're navigating a lot of that right now that we weren't doing 6 weeks ago.
Thank you. Thanks, Larry, so much for sharing and giving us that perspective. It is sobering to hear about just how quickly the impact has hit your families, and also how, in a very important way, your team has restructured from casework to deliveries of diapers and supplies that are needed to keep families safe. Jennifer, I know that you've made a similar pivot in terms of the kinds of delivery of services that your organization is doing as well. And so I'm going to turn the mic over to you for an explanation of how COVID has impacted your organization.
Yeah, similar to what Larry was referring to, I think that the speed and the breadth of the chasm that has opened up with the economic issues facing our families has just been kind of breathtaking. Well, I know in the Boston area, food insecurity has gone from like 9% to 38%, and that it just happened so quickly. I think that we weren't, as a community, really prepared for that precipitous of an event. I know at Women's Lunch Place, it was mid-March that we were on a weekly call, a COVID update call, where we started getting, really concerning information, and the health officials in that call were telling us to really rapidly look at our ability to social distance in our space. And we knew that we could not achieve social distancing given the architecture of our space. And so we had to quickly pivot to takeout service for our meals, remote service for our advocacy. We rearranged our physical space to meet these needs, but we're continuing to serve about 200 meals a day at our door. Our advocates have checked in with their caseloads, and we started putting together pantry boxes and delivering them, something we had never done before. We hadn't done home visits on a regular basis. Our advocacy was place-based. We do have an outreach advocacy effort, but that's really to reach women, on the streets or in our dining hall that won't sort of access services on their own. We're all outreach advocacy now. It's 100%. So what we found out is that this is a need that we wish we had known about sooner. We've had our advocates go to homes where they brought a pantry box thinking it would be a help through the next week, and they found apartments with no furniture, with no food in the refrigerator, with just no accommodations for communicating, no television, no radio, cell phones. So it's opened up a whole new sort of window to us in terms of the support that will be needed for our ladies in housing that we're extending into, but we now know that it will be a whole new program area. So we're learning a lot. We do put together really nutritious breakfasts and lunch and snacks to hold our ladies through the day. We are looking at ways to partner with other organizations. We have a pilot out right now preparing and delivering meals to some of Pine Street's rapid rehousing units. We're in communication with the City of Boston Food Czar, who the mayor has put in place. And so we're hoping we have capacity. We're hoping to be part of the big solution to the food insecurity that's happening right now. I think it's going to take a lot of people coming together, but I think we have the resources if we're organized to meet that need. I know for us too, we suspended our volunteer community, and that's a very special and unique community at Women's Lunch Place. They provide really the equivalent of 16 full-time employees for us, the hours that our volunteers put in. So we're also trying to explore if there's ways that we can engage our volunteers virtually, which I know we'll talk about a little bit more, but that's definitely been an interruption in relationships and services for our guests.
Absolutely. Thanks so much. So Darren, I know that there's been a big pivot for you as well in terms of outreach for families and identification of need. And I think that you've broken that out in terms of what do families need and especially what do seniors need. So I'll let you talk a little bit about that.
Yeah, Larry, thank you very much for giving that overview and sort of a day in the life of a family and a lower income family in Boston, especially during this time. I appreciate that. So I won't rehash that. But we, at the Cambridge Community Center, we really focus deeply, as Jennifer mentioned, on relationships. Relationships are really key for us in making sure that we're getting the best information from people and that people know that they can reach out to us when they need us. So what we did, and we did a few things. The first thing we did was we started calling every single family that enrolled in our youth program at any time since 2011. And we used our staff to make those phone calls just to check in. Some of the numbers, of course, were disconnected at the time. Others weren't living in Cambridge anymore. And we have continued to make those calls every single week to connect with our families. And clearly, on a weekly basis, the need gets more and more and more. One family in particular took 3 calls for them to finally admit that they needed food because they didn't want to, as they put it, sound needy. But because we were persistent, because we built that relationship, because we had a relationship with them beforehand, they finally did say, you know what, I need some food. And we were able to connect them with a food delivery service that's been happening in Cambridge. And food and supplies continued to come up a lot on these phone calls. Diapers, toilet paper, feminine hygiene products, and along with food. So what we did, in addition, a lot of food pantries in the area were shutting down because they just simply didn't have the space to do it in a safe way. So what we did was we took our large gymnasium and turned it into now what is one of only 3 food pantries operating in Cambridge, and it's a food and supply pantry. So we did a fundraiser. We're purchasing $2,000 worth of supplies every single week that we're distributing to families. And today is our 12th day, I guess. After this, I'll be heading over to the gym from our computer lab to work on that. And we've averaged about 650 bags of food and supplies per day. And the line literally wraps around our entire building, past our playground. Our building is a pretty big property. And we've been able to do that in a very safe way. Every volunteer has to take a symptom monitoring test on Google Form every single day. And then we take their temperature. They all have masks. They all have gloves. Everyone in line is 8 feet apart. They all have masks. If they don't, we give them one. And we set the food outside, 4 bags of food typically per household. On a table, they come up, they grab the food, and nobody at any point in time, never mind 6 feet, gets even 10 feet near each other. And we've been able to pick up the slack, again, from many other food pantries that had to shut down simply because of their physical space didn't allow them to do it in a safe way. We also have generational connections to the community, which is how we were able to get so many people to come to our pantry so quickly. It was really crazy. People would come up and they'd pick up their food and they'd immediately call their family member and they text their friend and then they'd be in line that same day. An example of this is one of our board members, Yvonne Gittins. She goes by Miss G. She just stepped off the board last year and her granddaughter replaced her on the board. She was on the board for 30 years. Her parents, her parents grew up here in the 30s and 40s. She went here, her kids went here, and then her grandkids went here. Her grandkids still come here from Philadelphia every summer to go to our camp. And I just mentioned her granddaughter replaced her on the board. And that's one of many examples. But for that reason, we have a vast database of seniors as well, who I mentioned come to our Thanksgiving luncheon and our monthly community meals. And we realized that we had to connect with them as quickly as possible and as efficiently as possible to, yes, check in on what they needed and how we could help. And we've been setting things up like food deliveries. Many people have been set up with food deliveries and prescription deliveries. But really, it's about the social isolation piece that we were wanting to really dig into. And that's what we partnered with Building Impact on, to create a system where seniors in our database, we have about 200 or so. We have well over 1,000 in our full database, but 200 or so that still live in Cambridge, who we have active phone numbers for, to get volunteers to sign up to make phone calls to seniors. And Bridget and I filmed a webinar so that people can sign up. They watch the webinar and they fill out a form on these phone calls with seniors that automatically creates a database that we can check every single day and respond to. And it's a color-coded database, so it's really quick and easy to check in on. And what's really great is that we're asking people to make the 4-week commitment so that the seniors are getting a call from the same person for at least 4 weeks, if not longer, depending on if they stay on, to help with that, building a relationship, social isolation piece. And there's just been many stories. Oh, and then they also ask the senior if there's anybody else that they think we should be checking in with, and we add them to the list as well. And one example of that was a family that we got connected to, a woman whose husband had just recently passed earlier in 2020. And when we called, she's religious, of course, and she said, God sent you. She's like, I didn't know what I was going to do effective tomorrow. And we were able to get her set up with food deliveries. She suffers from mental health as well, and her prescriptions had run out. We were able to get those delivered to her the next day. And that's just one example of, if we weren't doing this active outreach and going to get our seniors, short of knocking on doors, which we can't do, that would have been a connection that we would have not been able to make. So we went from, long story short, we went from a youth center that lets teens make hip hop music and serves dinner once a month to a senior call center / food distribution center. And it's certainly met the needs of many, many people in our community. And our staff, I just can't believe our staff who stepped up to do this. The person coordinating our food pantry a month ago was the 1st and 2nd grade lead teacher in our after school program. And he found out we needed to do a pantry. I'll do it. He stepped right up and did it. And then we've had engaged in well over 400 volunteers to support those efforts as well.
It's amazing. Thanks so much, Darren, for sharing that. So I want to dig into this a little bit more in terms of ways that you are using virtual volunteering to support these efforts. Clearly, each of your organizations has an incredible staff that has now, changed hats, worn many hats, and is keeping things running in terms of the outreach that you're doing. In Darren, your case, I think that the notion was that there wasn't a caseworker sort of staff already on hand, and so we're really, I think, grateful for the opportunity to sort of step in and do that first level triage so that your social services teams can support and can follow up. In the case of Larry and Jennifer's organizations, you have caseworkers, and it was more about sort of supplementing where there were gaps in the needs that were there. And so, Larry, I'll turn it back to you to talk about how it is that the virtual volunteering program really supplemented the outreach that you were doing to your families.
Yes, yeah. As I was saying, we've had to pivot our staff, but most importantly, or as critically, we've had to pivot our engagement with Building Impact. So we've been very fortunate over the many years to have a variety of different initiatives. I'm sure some of the folks on the call today have participated. Building Impact volunteers have painted houses. They've entertained our children. They've helped with Christmas in the City programs of helping us load up buses. I mean, a lot of great hands-on work. And unfortunately, as we've talked about now, under this current strategy of social distancing, it's very hard for our volunteers to engage with our families as they had in the past. As I mentioned, we have 1,200 children and parents. They're spread out. I call it the homeless diaspora. There are children and parents in many, many different neighborhoods. Many of them are living in neighborhoods where they don't have the social capital or the connections. There's not a community center like Darren's that provides the kind of support. So they're socially distanced initially, and now with the crisis, they're even more distant from everyone. So we've had to kind of pivot our work with Building Impact, and it's been incredibly important to us. So right now, as I mentioned, our offices are now, like Darren, our offices are now a food warehouse distribution center. We have all of our staff. We have food mapping routes where we're out with our professional staff in gear, knocking on doors and handing over bags of food. We've really struggled with whether or not to bring volunteers into that scenario. I have board members who are saying, let me go out and do it. And we're saying, look, we're trying to follow what the governor says for us, which is, given where our families are, given the fact that we don't have a central location like a community center, and because our families are so spread out, they're not in a neighborhood, they're not in a community, there are multiple communities. The best we can do is to gear up our staff with enough PPE, which is, you're reading, it's very hard to find. So we're struggling in getting that. So the limited resources we have right now, we're utilizing for our staff so that they can actually knock on a door and hand something to the family to keep them going. We have been working on getting materials for our families, but we're also realizing some of our families, because of different ethnic and cultural backgrounds, handing them a jar of peanut butter is actually culturally insensitive and not something a family may eat. And so we wanted to make sure that our families, some of whom live in culturally similar neighborhoods, would have an opportunity to do two things. One, give them some control over their lives. Give them an opportunity to keep the economy in their neighborhoods going, especially for those of our families who are in housing. And so we've really kind of leaned into a great offer by our friends at Building Impact to obtain gift cards that we can bring along with the basic supplies, toilet paper and diapers and things of that nature. And so those gift cards have been probably the thing that has put a smile on as many faces as we've ever seen, because now a family feels that they have some control in this really difficult situation, and they have an opportunity to go back to the bodega or the store near them and purchase a good which helps their overall community. That's been a fundamental shift in our volunteering work with Building Impact, but one that we're incredibly grateful for. And we know we're in this for the long haul, as now, as you all know, schools have been closed. That means our families are going to continue to have the same kind of economic struggles well into the summer, because now they cannot rely on the schools through the school year, and of course camps and other things are in question. So we're incredibly grateful for the help and the pivot that Building Impact has made with us.
Okay, thanks, Larry. I think that the pivot that you're describing was one that was clearly communicated to us by your case management team as being an essential component to providing families what they needed, and made it hopefully a little bit easier for your staff in terms of the backbreaking work that you're doing in trying to provide groceries for so many families, hundreds of families. And so this idea of a gift card for groceries program came out of that. Folks on our Building Impact team that are far more technically talented than I am created that in a virtual model so that individual volunteers can actually make that purchase as a virtual drive, but also select a gift card and share a message of hope, share a message of solidarity that is personalized to the family that's receiving it. And as you said, I think that is huge at this time, to have that outreach in a way that says we're in this together. In that way, volunteers who have participated in this program, I want to give a special shout out to Loomis Sales, or an organization that said, not only are we going to allow our employees to participate in this giving program, but also we are going to double the impact. So we will match any gift card that is sponsored by one of our employees, and we'll do that as a part of the employee matching program, which I just think is phenomenal. So I think our collective impact can be even greater in the work that you're doing. Jennifer, I want to pivot over to you. I know that along with takeaway meals, there was a real concern on the part of your teams in terms of what it was that you could provide to help folks to be able to have the hygiene products that they would need. At this. So I want to turn it over to you to describe a little bit about how your team is using this virtual volunteering.
Yeah, sure. So actually going back to our very founding, our founders were volunteers at Pine Street Inn that were seeing women dress as men to get a bed, and also that they weren't getting services that were directed towards women that they really needed. So one of the things that we always have provided at Women's Lunch Place is, personal care products, and we have sort of storage facilities, and women can come up and ask for the items that they need, and some sort of choice is usually offered. So if it's shampoo, then would you like this brand or that brand? Choice is, an important element that we try to bring to our guests because they have so little choice in so many aspects of their life. And also because it brings dignity to have these products to be able to care for yourself. So not having that sort of in shelter situation, we wanted to have to-go packets for our ladies who were coming to the shelter. And so your team put together these amazing toiletry bags that just contained really essential items for self-care, and were also beautiful. And I think I talked about dignity for our ladies, but it's those special touches that make women realize that we are treating them with respect and dignity. So they're something that you can sort of put together virtually, which was great. Teams can either select different items and bring them together in one location, or an individual can do them on their own, but they are really life affirming to our ladies. Another aspect of that is putting together personal protection equipment sort of packages for our ladies, being able to clean surfaces, or wear a mask, or have hand sanitizer. I mentioned this, I know before to you, Bridget, but our ladies know what is going on with COVID and know how they should be able to care for themselves, but they don't have that opportunity. If they're in shelter, they don't have the ability to social distance. If they are housed, they don't have the money to buy those kind of supplies, or they go to the store and they're not available, as we all know, as we're trying to seek it for our staffs as well. So those sorts of projects, putting those together, have been just critical in terms of supporting our ladies.
Great. Yeah, I think that for us, the idea that your team came up with of how it is that we could create these kits that could be a part of the takeaway package. Yeah. And as I said, I was so thrilled to have an opportunity on one of the deliveries to see that selection process in the works when one of your beautiful ladies came up and selected the fuchsia bag that she wanted, and that notion of connection to something that is choice and has been carefully crafted even online. And so the way that program works is to have a virtual assembly of the kit. We then assemble it again, gloves, mask, with the PPE, proper delivery at the social distance, so that it can be delivered in that way. But our volunteers still can do something that is personally connected with the selection, again, of a greeting that goes with it, and a delivery of a message that's there. Garrett, in terms of the system that we had the opportunity to build with you, you came to us with a list of, I think, 205 folks originally, and said we've got to figure out a way to outreach. But you had emphasized, as you talked about, how important it was to have that relationship building, the trust factor of having the same volunteer over a period of time. And so that program is one that we call skills-based volunteering, because it requires that you go through the training to learn how to do the proper triage system, so that your folks can take in the folks that, that form that is color-coded with highest need identified through that workflow that is generated out of the form that the volunteers complete. So the volunteers have been trained and have made a commitment so that they can be in touch. I thought maybe just a moment to talk a little bit about how those calls have gone. I think that the notion of both a triage system of identifying need, but also the notion of a relationship building as well, that the important thing of not just having a 5-minute call, but maybe, as you said, up to a 50-minute call. Let me get you off mute here. There you go.
Yeah, no, I think it was, you said it well when we were first talking about it, that we'd rather have them do one 50-minute call than 51-minute calls. So to build that relationship as much as possible. And similar to what Larry was saying, our partnership with Building Impact pivoted as well. We're actually engaged in another project that has to do with making our enrollment process more efficient in our out-of-school time programs, because there's 7 or 8 different ways the kids can enroll. So we're part of that project, and it was actually on one of those calls that we were discussing that project that I brought up. I was like, and we also have these seniors that we're trying to figure out a way to get in touch with on a regular basis, and eliminate or help mediate social isolation and loneliness. And by the end of that call, that's all we were talking about. We were really focused in on making that happen. And Bridget's team very quickly created an awesome system that is very user friendly. Like I said earlier, we filmed a webinar to make sure that the volunteers knew the volunteers had to feel comfortable too. It's definitely skills based, but if you're just calling someone and you don't know what to say, that's a difficult call to make. So we tried to make it as, yes, give them skills, but also make it as sort of straightforward and easy as possible, but also with the leniency to be conversational as you start to get more comfortable with the person you're talking with. And that's gone, very well. The calls have been made. We've been able to track a lot of information around the seniors that we were calling. One key component is that the volunteers say, "Hi, my name is so-and-so. I'm calling on behalf of the Cambridge Community Center." A lot of these seniors went to the center in the 30s and 40s and 50s, and they've been involved coming back every year for our Thanksgiving luncheon and our community meals, and their grandkids go to the center. So just right then and there, we build a level of familiarity and trust that allows them to feel comfortable and open up a little bit more. And just going through the spreadsheet and the notes, they're just beyond grateful. And I'd say, 75%, 80% say, "Yes, please call me back next week," at least. So they acknowledge that they just want, "Yes, please call and check in with me." We even had one senior that said, "I'm going to go for a walk. Can you call me later today?" And I believe the volunteer did follow up and called her later that day. So it's really been, it's something that we wouldn't have been able to take on our own. We are a small staff. We have 5 full-time people, one of which is doing a lot for the pantry. Others are, making sure that they're calling our hundreds of families who are enrolled in our OST program. We knew we had to do this, but we also knew that we were tapped out in terms of capacity to do it. And Building Impact, that's their name, is they build on the impact. And they've allowed us to do exactly that through engaging now 200 volunteers. There's a wait list of volunteers at this point. And what we've been able to do as well is open this up to other organizations in Cambridge. So using our connections to other organizations in Cambridge, and reaching out and saying, "Hey, this is a really great system that we've devised here. It's an incredibly efficient way to keep in touch with your seniors and to make sure that they're getting what they need and getting the communication and the connection that they need." We've been able to reach out to other organizations who have also now provided their list of seniors, who are also now having volunteers call on their behalf. So again, we've been able to turn this into something that's benefited more than just our database through this partnership.
Absolutely. Great. And I think, again, as you said, it's a model that can be created and shared. And so I think if you are a nonprofit on this, listening to this webinar, and who say we don't have the case management outreach that we need, I think it's, we see this as we extend it, working for families and for community members who might not be able to go and seek services on their own and have limitations in doing that, and that we can offer that support through our volunteer network. So I want to take just a moment to pivot and first say thank you to the over 675 volunteers who have participated in one of these programs already, because it is a tremendous outpouring of love, support, and community togetherness to really pull these programs off, and we would not be building impact without you. For those of you who are thinking about ways to engage your team, I want to turn it over to my colleague, Elsa. Elsa Gomes-Bonlo is a new member to the Building Impact team. We're so lucky to have her on this is the week that she is celebrating her 3-month time at Building Impact, but she has been a critical member to helping us to think about our outreach and how it is that we can make this pivot. And I want to turn it over to her so that you can hear a little bit about how you can get your teams involved in these programs. So Elsa, let me turn the mic on for you. Okay, here we go.
Okay, thank you, Bridget, and thank you everyone for joining us today on this important webinar. If you're thinking of, can you hear me now? I want to make sure people are hearing me. If you're thinking of,
I think there was a little technical glitch. I want to make sure I'm turning it back to you. I think we can hear you better now. So here we go. Okay, I'm sorry about that. Just a quick shout out to all our volunteers that have been involved already. As Bridget mentioned, over 700 people, almost 700 people have helped us this week, and it's Volunteer Appreciation Week. So I just wanted to give a shout out to the volunteers to make sure that they know that whether it's COVID time or outside of that time, volunteers are critical to the missions of organizations. Nonprofit organizations depend on funding, but they also depend on dedicated volunteers to provide the services that they need to provide. So in times like this, you are crucial, and we thank you for, even from the comfort of your home, being able to do something for other people. If you're thinking as individual, get involved, go to our website, buildingimpact.org, and find ways to get involved, but also as a team. Building Impact works with normally corporations and involves and engages the workforce of those corporations to give back to the community in a productive way. Of course, always in conjunction with listening from the needs of these organizations, as you heard today, and to formulate and co-design projects that are going to address the core needs of those organizations at the time. So again, go to our website, find a way. We have 3 main ways of getting involved. One is to share your thoughts and support the community around you by sending messages of hope and thanks to our frontline volunteers and healthcare workers and other people that are essential personnel at this time. We have a longer, like older school way of getting involved, which is to share your ideas on a letter, sending letters to seniors that are isolated instead of making those phone calls that are a little bit more of a long-term commitment. We have ways to create kits, as you heard Jennifer mention, for her organization, hygiene kits and care kits for women that need them, and then also sharing your skills with the calls that Darren mentioned for the Cambridge Community Center elders. And again, that's a 4-week commitment, a week, an hour a week for 4 weeks. Go to our website, find out ways to get involved. If you're not already part of our network and you're thinking of getting your team involved, this is a great time. We're really eager to partner with corporations and groups of teams to provide more kind of personalized support during this time. We want to make sure that people can do virtual kits together or get the phone trees, then do it together as a company. We want to make sure that we are providing these opportunities. We are inviting ourselves to come speak at some of your meetings, whether your meetings are happening virtually as a team. This is the time or the season where we would be planning days of service where companies go out together and volunteer for a day.
That's not going to be happening right now, but we would love to explore ways in which we could support companies volunteering virtually, all in the same day, but together, separate, with social distance, and being able to do something collectively. So please join our network to find out more information about it. These webinars, as the one it was today, are going to be happening. There's 3 of them, so this is the first of a series of 3. There will be one on May 22nd around the same time, the lunch hour time, that is going to engage the community corporate social responsibility leaders. We're calling it a corporate social responsibility summit, that will really bring together people that are on the corporate side thinking of how they can engage their team better at a time of social distance and bring people together and community together, and how their companies can support the community at this difficult time. And then on June 25th, that would be the day that we were going to have our non-gala, which is our annual event that brings together all our communities, both our partners where people can volunteer for our nonprofits, but also our corporate supporters. And we also give awards for volunteerism in the community for the work that people have been doing and the impact that they've provided for that year. So this year, since we can't get together in person, we're hoping to get together virtually. And it will be a vino and volunteering type of idea where people can have some wine at home and join us and do some projects together, and we can highlight some of the work that we've been doing together and kind of celebrate the work that everybody has been doing. Our organization has its roots with the community from corporate real estate, and we want to bring that community also to the forefront because they own the buildings that are now empty, and we need to also think about ways of how they are supporting the community, and we're coming together. So we're thinking of ways on how the CRE community, the commercial real estate community, can come together and also give us a little bit of feedback of what they've been doing in this times of needs. So we have also created a COVID Innovation Fund at Building Impact to kind of help us support these organizations at their time of need and create innovative ways, as you've seen some innovative ways that have been already created. But we would love to have your support with that. Please get involved, find out more information in our website, and hopefully we will engage you in our work in the months to come. I believe it's going to be a while until we get out of this, but together we can do it. And I'm sure that if people band together at this time, we will get out of this stronger and better, because the system we had before was also not working for a lot of people. So we want to make sure that the new normal is a better normal than we had before.
Thanks, Elsa. Thanks so much. With that, I want to come back to our panelists for one final question, and then we open it up to the group. And that is really to think about where we go from here. Specifically, there are, I think, relief funds that you each have set up that can be supporting your work. There is also a set of needs that are ongoing in terms of ways that we can advocate for organizations like yours that are doing this important work. And so I want to just turn it back to our panel to say, you know, where can we go from here, and how can we continue to support the work that you're doing? So just to keep in sequence, I'll go back to Larry for this final question. So go ahead, Larry.
Well, thank you, Bridget. And it's really exciting to hear all the great work that's coming forward from Building Impact. So a quick moment for us to think a little bit about where the world is headed. So we've talked about the medical crisis. Ultimately, we'll get over that at some point, and then we're all going to have to be crawling out of the wreckage. So a thought for all of you is to think about the ways you've helped us to build impact. We're going to really need your help to rebuild our families. Those of us who are on the lowest economic rudder or ladder line we're already struggling before COVID hit. They're going to have the most difficult time climbing out of this. And so I think there's a lot of opportunity for all of us to think collectively about how we can help our poorest neighbors find a way of some self-sufficiency in this difficult time. So for us, as we look out, we realize that our work in delivering supplies and goods aren't going to end when people come back to work. They're going to have to climb out of this. Many of our families currently are not making enough money to actually get the unemployment benefit or the federal benefits that are coming. And so their need for basic things like diapers, baby food, gift cards to go to the local bodega and buy the food that means something to them, that brings them comfort and support, is going to be long term. So that's, I think, where we're headed, is that we realize this is a long game, not a short game, especially for the families who are kind of at the most difficult point of the economic crisis to this. So what we're hoping is that there will be opportunities for us to work together as we look forward to what we can do. We do have a website, Family Aid Boston, it's all one word, .org, where we have a list of things that we're looking for, and obviously help for us in purchasing diapers. We realize right now on a weekly basis, our families need 9,000 diapers a week. 9,000 diapers, because we have over 300 kids who are under the age of 2 who are in our care. So those are the ways I think that we could potentially work together to think about how we can help support families make their way to a better place after this crisis is over.
The other thing I would just add to that, I think it's important to remember, is that those families that are receiving the supplemental programs that are, whether it's WIC benefits programs, for many of the products that you're mentioning, whether it's diapers or feminine hygiene products, are not covered in those programs that are there, and so therefore the need for having the ability to have a gift card to buy those groceries that are needed is essential. In terms of your drive, Larry, on our site, the grocery gift card program is still going. Our goal is to be able to run that program as long as it's needed, and especially in this, we know that you do deliveries every Friday. So our hope is to be able to top 150 families that we've reached by next Friday. We got to 70 last week, in the very first week that we launched it. So I think that is a goal for all of us in being able to support. Jennifer, I know that there is a set of work that you're doing as well in thinking about what comes next, including your pantry program. So let me just turn it to you next to talk about where we go from here.
Yeah. I agree with the comment that we can't go back to the old normal. We have to look for a new model. I know we're already planning for, sort of return to regular services. They won't, albeit, be regular, but we know that there's going to be an exhaustive need for advocacy services around support for housing and food security in particular. And we need to ramp up for that. And I think my fellow colleagues here have also been dealing with what we have, which was the complete kind of obliteration of our spring fundraising season. So it's kind of a double-edged sword in that we know that the need is going to be that much greater, and at the same time we're really struggling to find our footing in terms of what our development campaigns will look like going forward. So those two together are challenging, but we will need it. But we know that we'll have to invest in staff that can do that sort of advocacy, that can do the direct care work for our guests, and also just the physical structure of our building. I mentioned earlier that due to it, we really couldn't safely have community there. And we're already looking at what investments we might need to make in terms of rearranging the workflow there. So those are all challenges ahead. I think that we will, be able to engage folks in supporting us, but definitely not having our volunteer crew on the ground with us has been challenging. We do have opportunities for virtual volunteering, and you can find all that information on our website, which is womenslunchplace.org. And I think we're looking forward to continuing our relationships with our guests and with our volunteers, who are really a special part of the community.
Great, thank you so much. And I think we'll be looking at opportunities around some of the important dates that are coming up on the calendar. We have Mother's Day that is coming up. We know that many of your beautiful ladies are mothers as well, and we want to make sure that we have special ways of acknowledging those days and delivering services at that time. Darren, I want to turn it over to you. You had mentioned the program that you're involved in. In addition to all this work that you're doing on capacity building for responding to the needs of COVID-19, you and Jennifer's organization are engaged with us in the Leading with Impact program that Building Impact partners with MIT on. And I know you're doing a bunch of capacity building work for how it is that you're going to be able to support the enrollment of kids coming into your program. So I didn't know if you wanted to just speak about, and the side job, this Saturday, you kick off a set of work with that MIT team. So I wanted to just turn it to you to talk a little bit about how you're spending your Saturday.
Yeah, thanks for the reminder. Yes. Just in terms of not going back to how things were. I read an article yesterday that said, everyone keeps calling this the great equalizer, but it's really the great revealer, where people are seeing, when I go out and tell people we work with the most under-resourced, underrepresented members of our community who are living in conditions that you probably didn't realize existed in Cambridge. This is the proof. This is what we mean by that. And it's become evidently clear that the way things were working before were not working. And even for people who wouldn't even consider themselves as in poverty or low income, realized that they were only in a position to make it for 1 or 2 paychecks. And then they're the ones who are lining up for food and supplies at this point, didn't think that they would be in that position. So yeah, one of the things that we're working on right now, in addition, is our virtual summer program as well. So we're fully expecting not to be able to run a program here at the community center. So our OST staff, in addition to making those phone calls every week to our families, are working on building out a virtual program. We're going to be partnering with Harvard to do some of that work as well. And then I'm also on a committee with the Cambridge Nonprofit Coalition that's meeting with the school district next Thursday to talk a little bit more about that. So we are really trying to reshape the way that this work is done in the future, so that people aren't, this is what vulnerable means. This is what vulnerable means, that something like this can come along and it puts people in a position that they thought they were more stable, or they thought they were more secure than they really were. So, yeah, we'll be working on our enrollment process, which will be more important than ever, because we'll be re-enrolling a lot of new kids, and we'll want to be able to do it in an efficient way. And we didn't realize that this project would be learning how to enroll kids virtually as much as it's going to be, but that's certainly what we'll be working on with the Leading with Impact volunteers as well. And we do have a COVID-19 relief fund that's on our website at cambridgecc.org. And that goes directly towards paying our staff. We haven't laid off any staff that is in the risk population, so seniors above 60 or anyone with immunodeficiency condition are being told that they can stay home. They're still receiving their regular paycheck from us. Another project we've worked on with Building Impact last year was our rental system. So we rent out our facility when we're not running programs, and we use that money to supplement the cost of our quality programs, so that the burden of cost isn't on those who need those services the most. But while we had to shut down, we're losing $10,000 in revenue a month from that. In addition, we're fundraising so that we can spend $2,000 a week on supplies to distribute to our families who are coming to our pantry. And again, we're still paying all salaries, including benefits, health insurance, which we provide for part-time workers here as well. So, we've been able to raise some funding to this point that's sustained our ability to continue operating, but we don't know how long that'll go. So any amount that people can give to our COVID-19 relief fund will put us in a more secure position to do this work for a longer amount of time. And again, it'll go directly towards paying our amazing staff who've stepped up during this time, and also purchasing those supplies to distribute from our distribution center. So.
Thank you so much. So I just want to take a moment again to thank all 3 of our panelists today. I'm going to take a quick look at the comments in chat, but given that we had so much to talk about, we didn't have so much time for our Q&A, but I would invite you to, if there are specific questions or ways of getting involved that we can support you with, you can find us at volunteer@buildingimpact.org in terms of an email address that will come to our organization that we can help to connect you with the follow-up with each of the panelists as well. I also just want to acknowledge that for all of your teams. You are first line support for many of these families. Our gratitude board belongs to healthcare workers, and it also belongs to all of you. For our families who for employees and families who have participated in our gratitude board, you all will be recipients of those gratitude boards as well. It's a virtual board and a way of sharing a thanks to your entire team for the work that you continue to do in our community. And so for any of those folks that are on the call who haven't yet had a chance to participate in our gratitude board, pop on up a message of gratitude and support for these organizations and these teams. It's a great time to share. The last thing I will just speak about is we have one other kind of virtual board, which is a really important board at this time. Part of what we talked about today is how differently the COVID-19 virus is affecting communities at the low income level and communities of color. The YW has partnered with Building Impact on a board that we are creating to support their Stand Against Racism campaign. And so you'll be seeing more about that on our website next week for a virtual board to support that. We aim to strengthen the community in every way possible, and to be inclusive in that work on all fronts is a really important ingredient to, I know, all of our organizations as well. So I just want to say thank you to all of you. Thank you to all of you who have joined us. And again, to the hundreds of folks who have volunteered with us to support these programs, please tell your friends and stay involved to build more impact. Thanks a lot. Stay in, reach out. I'll talk to you all soon.